Hey, it's Dr. Amanda with Straightsmile Solutions, straightsmilesolutions.com, and today we're going to talk about tooth erosion and orthodontics, what's better, braces or aligners, what you should do about it, what's standard of care, what I recommend doing before you even touch these patients. So let's go ahead and just recap on what is this and how do you know it's erosion versus attrition. And erosion just presents like a certain way. It doesn't quite look like attrition. So just in the pattern of the wear, and other things. So let's talk about what things can cause erosion. And this is a good example of an erosion case. So it either could be something dietary or some type of drug, some type of medicine. It could be something organic, like having GI issues, could be pregnancy, and you get a lot of regurg or GERD, gastro reflux during pregnancy. But my opinion is that you never want to treat these patients until you've localized and found the cause of the erosion first and make sure it's being treated. And you don't take the patient's word for this. Absolutely not. That's putting yourself at liability if things are still happening. You're going to have to play a little detective. And to be really honest, the times I've dealt with this, the ones that are really forthright and they write it on their medical history and they bring it up, sometimes it's embarrassing. It could be bulimia, past or present, and it might not be something they want to do in front of other people. So you might want to take them aside. And I've seen it in kids too. I mean, and there's a lot of denial that goes on. So if you're getting the runaround, you're getting denial, don't treat this patient. I'm assuming if you're listening to my video, you're probably a general or a pediatric dentist. So you are the patient's primary care dentist. If this was an orthodontist listening to this video, then you're going to go back to the patient's general dentist. You're going to ask for, tell them you're going to be asking for a medical release from their primary physician and a referral to gastro as needed. And remember, in dentistry, we're treating the teeth, but we're also treating the health of the mouth, which is related to the health of the body. So there's going to be a lot of things that we're going to be the first eyes that a physician may not see. They may not notice erosion on the backs of the teeth. That's not something they're checking in a physician's office normally, unless you ask them to. Why are they checking your teeth, right? I mean, even my kid's pediatrician, she looks for like about 1/10 of a second. She has no idea what she's looking for. I just laugh. She asked me now, but she doesn't know what she's looking for. So it's pretty funny when I see her looking, I'm like, really? So she's like, oh, sorry, I got to. But don't let these patients try to push you around because you are responsible for this. So if there's something going on and then you're just like, cool, I'm going to do some Invisalign. You're going to get yourself in trouble later. So absolutely not. And like I said, the ones that are forthright or concerned, if they didn't know about it, are the ones now I'm going to feel more comfortable treating them. The ones that are, sketchy, dodging it, evading it, in denial, I'm not treating them. So again, things that can cause it, GI reflux, fine. If they admit it's GI reflux or they admit they had a history of bulimia or maybe they had reflux but it doesn't go on anymore, say, no problem. I'm going to send a medical release to your physician. Can you sign this so I can send it? They're going to sign off saying it's under control. We're good to go. Or they might refer you to GI. Usually, if it's something that, they've taken care of, they don't have a problem with that. I'm sorry for the extra hurdle, but it's just something I have to do just to make sure I've done my due diligence. Bulimia, alcoholism, certain types of beverages like energy drinks, sodas, a lot of acids, eating lemons, sports drinks, Gatorades, just eating a lot of fruits. So also like hard drugs like meth and things like that. So I've seen it many times. So just want to encourage you not to take these cases. Now, let's say we did get the medical release signed from the physician or from the and also from the general dentist, if they knew about it. If you aren't the general dentist, they say it's good, it's under control, and it's signed by the physician. They say it's okay to treat. Fine. You got to keep in mind you've got unsupported enamel here that very well can and will fracture during treatment. So you're going to have your patient sign something separate saying that you're not responsible. I certainly wouldn't be doing braces because just popping those braces off, I've seen them fall apart. So it would be aligners and might have to do some restorative first, just to get rid of the unsupported enamel and to give enough retention to bond onto, at least smooth the edges and stuff like that. So, ultimately, that is going to go to the general dentist. You're going to let them know, hey, I don't have enough tooth structure, here. to treat this. So you're gonna have to restore that first, whether we temporize or something else. And please reduce or eliminate all unsupportive enamel before we start. Put that on the GP. You know, let them take care of that and make sure they're prepped and ready to go. Then you're gonna have to use a lot of attachments, like a lot, you know, all over the place. So, I mean, this might be one that's better for a higher trim line kind of case, you know, like Clear Correct. I know I don't say that very often, but this would be a case that maybe I'd be more likely to use that than Invisalign. So just something to keep in mind, or another kind of white label aligner company or something like that. But of course you want to keep your movements really slow, like crazy slow. Like I normally say double it, triple it, maybe times 5, times 8, because the problem is, I'm kind of joking, but I'm not, because if there's a hard push in, those teeth will fracture. You know, the unsupportive enamel will fracture. And it needs to be like so gradual, like changing every couple days. So we want to do everything we can in our power to avoid big steps here. So if Clear Correct is the case is 20, it's now 60 to 80 for me for this type of case, you know, with a fair amount of attachments as needed for retention. So I know Clear Correct's not going to like that, Strawman, but sorry, you know, this is the right way to treat this type of patient. All right, thanks so much.